My name is Daniel Tirsoreanu. I'm a P1 student at the U of A College of Pharmacy, Phoenix campus. For my student interview, I interviewed a P4 student by the name of Amy Nguyen, and she also goes to the Phoenix campus. She told me that she really wants to become a hospital pharmacist one day, which is a career I'm also interested in. And on the day I interviewed her, she also told me that she's preparing for her PGY1 residency interviews. The rotations that she did so far at the time of my interviewing of her were at the Tucson VA doing internal medicine, at the Banner University Medical Center in Tucson working at a transplant pharmacy, ambulatory care at the Mayo Clinic in Scottsdale, a psychiatric rotation working with patients dealing with substance abuse at the Phoenix VA, and Encompass Health in Scottsdale doing hospital and health systems pharmacy. The first rotation she talked about in the interview was her time at the Tucson VA. She told me that even though she was a student at the Phoenix campus, she didn't want to limit herself, and so she even got temporary housing in Tucson, and she wanted to do at least 2 more rotations in the Tucson area. This rotation was considered to be an elective rotation. It was her internal medicine rotation, and it's also considered acute care. So since it is an elective rotation, that means it's not one of the general or required rotation that pharmacy students have to take in their last year of studies. Students in their 4th year are expected to do 8 blocks, which consists of 7 rotations. Those 7 rotations each last about 6 weeks, and it also counts as, there's also an off block included in the whole schedule. My interviewee, Amy Nguyen, told me that even though most students going on rotation at the Tucson VA have 2 blocks as a requirement, her first block was an off block because of COVID. And so she was only there for 1 block. Now, how did a typical day look? She told me that on a typical day, she would come in at about 7 a.m. and there'd be multiple different healthcare teams. She would have a lot of interactions with other healthcare providers, and it was really interactive with other professions in the medical field. At the Tucson VA, she would have to do rounds every day. And so each team of those multiple different healthcare teams would have to see between 8 to at most 16 patients a day. And so on her typical day, at about 8:30 or 9, depending on the doctor, she would begin her rounds. Now, when she would go to these rounds, beforehand, she would have to work up the patients. When she works up the patients, that means that she's looking at their medical history, collecting all the pertinent information and data. She would also look at their medication regimes, see if there's like a home regime or medications that they were taking at home, to make sure that when they're admitted to the hospital, they're still on the same medications. And she also had the chance to check different lab values such as potassium and serum creatinine to make sure that they're not changed in a certain way. When the potassium levels or when the serum creatinine levels are different once they're admitted in the hospital, that could have a certain interaction with the drugs being given. And so starting at 8:30 or 9, the pharmacist would go on rounds with the doctor and certain other people of the healthcare team. And so they'll be doing rounds from about 9 to 11, and that means they get the chance to talk to patients, they can see them, they can also discuss amongst themselves any patient-specific recommendations, and that includes intervention strategies that the healthcare team finds necessary. So they're looking at all this data together, and the doctors will be communicating with the pharmacist or a nurse if they're present, and they're looking to see, can a certain intervention take place for this particular patient? Okay, so after 11, when all the rounds are done, my P4 student mentioned that she'll be working on different projects or taking notes. And so even though the first 3 years of pharmacy school are didactic years, and when we go on rotation, we don't think we're doing homework. We'll actually still have a lot of stuff we have to study on the side. And that consists of, for example, the preceptor can ask us when we're on rotation certain DI or drug information questions. And so my P4 interviewee might be asked a certain question that she would have to answer and give us a response to. It could be on a particular drug, it could be on the mechanism of action, it could be like, what's the first line treatment therapy for this type of patient case? And so she would have to be well adapted to these kinds of questions and know how to study them to apply them in her pertinent medical field. Next, she also had to prepare for topic discussions which happen each week. So topic discussions is when you're at the internal med, and this also applies to other pharmacy rotations, you'll have a certain day of the week where you'll have a discussion and be quizzed on like a certain topic that you're assigned. For example, one topic discussion might be on UTIs one week, the next week could be on gastrointestinal disorders, and so on. So she would be at the hospital from about 7 to 5:30, and she mentioned how the morning time would be the busiest time of the day. Thankfully, I got a lot out of my interview experience with Amy. She was really nice and cooperative, and when I asked her any question, she was happy to clarify them and explain the different concepts that I didn't understand at first. She mentioned how these rotations are super important as a pharmacist when you're applying to residency programs, and they're important to include in your residency interviews. She also mentioned how the last year of pharmacy school, the P4 year, is one of the most fun years of your whole school career. I really liked hearing her talk about clinical pharmacy, especially when she mentioned transplant pharmacy, hospital health systems pharmacy, internal med, and ambulatory care. Also, Amy really wanted to go into hospital pharmacy because she values one-on-one interactions with patients and seeing them become better through good healthcare practice. Additionally, for a hospital pharmacist working in the field of internal med, it would typically require 2 years of advanced pharmacy education. And so that means that pharmacists interested in that field would have to take a PGY2 residency program or postgraduate year 2 on top of the first year of residency. I'm also very interested in the field of hospital pharmacy myself, and I want to get direct patient interaction with patients. I'm not sure what specialty I'm planning to specialize in the future, but hearing her talk about all these different rotations and all the places she went and how much those experiences meant to her, and just how rewarding it was overall, strengthened my interest in the field of hospital pharmacy as well.